Hello friends, I hope everyone is doing well. It's been long time that I didn't make any videos. Actually, I was a bit busy in settling my new college, so couldn't make videos for you guys. But today again, I'll teach you some new topics. So today it was IRICT November 2023 exam. So I hope everyone has given your exam best. I hope everyone given their best of preparation and you have all have given your exam very nicely. And this time there are some changes in papers, but it's all right. Don't panic. Still NEET MDS is there and you can always give your best in NEET MDS 2024. So today we'll study one new topic of pharmacology. I know pharmacology is a bit hard for everyone, but don't worry, today we'll try to understand it in a very easy way. The topic of today's class is respiratory system drug classification. So let's get started.
So respiratory system drug classification. So under respiratory system drug classifications, they are classified as a anti-Ig antibody, mast cell stabilizer, lipoxygenase inhibitor, leukotriene receptor antagonist, bronchodilator, and the drugs which decrease inflammation of bronchial hyperactivity, and lastly monoclonal antibodies. They are the newer drug. So the drugs which comes under anti-Ig antibody is omalizumab. I know it's hard to remember, but remember it's like that, omalizumab. You repeat with me, omalizumab. Then mast cell stabilizer, sodium chromoglycates, nidocromil and ketotifen. Sodium chromoglycate, nidocromil and ketotifen. Then lipoxygenase inhibitor, xylutone. Lipoxygenase, so it's xylutone. Then leukotriene receptor antagonist. Leukotriene, remember leuko, so it's montelukast and zafirlukast. So leuko and cast, so remember it's like this. Then bronchodilator. To remember bronchodilator, you have to remember BAM. In B, it comes beta 2 agonist. Under beta 2 agonist, again is salbutamol, salmetrol and formoterol. Salbutamol is short acting and salmetrol and formoterol are long acting. Remember metro city, so metro cities are hi-fi cities, so it's long acting are metro. Wherever there is a metro, it's like long acting. So salmetrol and formoterol are long acting. Then anticholinergics, ipotropium bromide and tiotropium bromide. Then comes methylxanthine. Methylxanthines are the drugs that are no longer used nowadays. So under methylxanthine, it comes theophylline, caffeine and theobromine. Then comes the drugs which decrease inflammation and bronchial hyperreactivity. So these drugs are corticosteroids. Under corticosteroids, it comes beclomethasone, budesonide and fluticasone. And lastly, the newer drugs are monoclonal antibodies. They are again classified as interleukin 5 and interleukin 4. Under interleukin 5, it's mepolizumab and breslizumab, and interleukin 4 is depilumab. Now the drug of choice for bronchial asthma, aspirin-induced asthma and exercise-induced asthma is salbutamol. The newer edition mentioned that the drug of choice for bronchial asthma, aspirin-induced asthma and exercise-induced asthma is low dose of inhaled corticosteroids and formoterol. And whatever questions normally they used to ask for NEET MDS, I already mentioned here in my pink notes, or you can see some black pen I already mentioned here. So you have to just go through my notes, you have to remember all the points whatever I mentioned here, and then you go through the book Sparsh Gupta and try to solve as much MCQ as possible from that book regarding this respiratory drug classification, I mean respiratory system. So I hope you can solve most of the questions if you go through my notes. So let's revise what are the points they used to normally ask in NEET MDS. So they will ask the questions like that, the drugs that are used for preventing exercise induced bronchial asthma. So the drugs that used in preventing exercise induced bronchial asthma are sodium chromoglycate and nidocromil. Under xylitol, they will ask you the short duration of action. Name the drug which have the short duration of action, and the drugs which are hepatotoxic. So they are xylitol. And under leukotriene receptor antagonist, they are very effective in aspirin induced asthma, and fewer cases of Church-Strauss syndromes are reported in patients who use leukotriene receptor antagonist. Bronchial dilators are very important topic. They mostly used to ask questions from this topic. So under bronchodilators, they are the only drug which are used for acute asthma. So bronchodilators, beta 2 agonist, salbutamol, salmetrol and formoterol. And how to remember, I already told you, metro. Then methyl xanthines, they inhibit phosphodiesterase, so thus they inhibit cyclin AMP pathway. They again increase histone deacetylation. So they are no longer used, but the drugs which comes under methyl xanthines are theophylline, caffeine and theobromine. The theophylline, they reduces the frequency of apnea in premature children. They again act as an antagonism of adenosine receptor. And they mostly used to ask questions like which drug inhibit the metabolism of theophylline. So ciprofloxacin inhibits its metabolism, and overdose of theophylline causes seizures. Now the corticosteroids, they are also very important drug. So the adverse effect of corticosteroids, I think, is the most favorite question they used to ask. Like the adverse effect of corticosteroids are hoarseness of voice and oropharyngeal candidiasis. And again they sometimes used to ask questions like for soft steroid, which drug is used in bronchial asthma. For soft steroid, they use cyclosomide. And for acute severe asthma, which drugs are used? For acute severe asthma, the drugs which are used are magnesium sulfate, IV or inhalation, and steroids. And already I mentioned what are the drug of choice for bronchial asthma, aspirin induced asthma and exercise induced asthma. So it's salbutamol. And the adverse effect of beta 2 agonist, they used to ask like muscle tremor and tachycardia. And salbutamol can also cause hypokalemia.
So I hope you all have understood this topic nicely, and any questions, any queries, you are always feel free to ask in my comment section. And very soon we'll come up with a new topic in a new interesting way. Till that, keep studying, keep giving your best, and all the best.